What's up, guys? Welcome back to another episode of the Dad Bod Pod, a place for men to learn, grow, and live the healthiest life possible. I'm your host today, Jason Priest. Zach and Anthony are not with us today. We have a great guest on the show today, and I'm excited to speak with him, and I think you guys are going to get a ton of value today. If you're a first-time listener, I highly encourage you to go back, check out some of the episodes, our prior episodes. We're 130-something deep now. We lay out the entire game when it comes to optimizing your health for peak performance. So go check some of those out. If you're a longtime listener, thank you so much for continuing to follow us and stay plugged into our podcast, man. Obviously, our mission is to make a difference, man, make an impact in the world and help other men become the healthiest and most elite version of themselves. We don't run ads on this show. If you get any value out of today's episode or any of the prior episodes, please do us one favor. Take 10 seconds, 15 seconds out of your day. Drop us a quick review. That helps the show grow. That helps get the show into the ears of more men who could potentially change their life and become a healthier version of themselves. And if you have any content suggestions, drop those in the reviews. We read every single review. You guys seem like you're getting a ton of value, but if you have things that you want us to cover, we're more than happy to unpack a lot of that, man. And so we have a ton of fun doing this show. So thanks for being here. And without further ado, I have with me today, Dr. Carlos Sanchez. And he's board certified in emergency medicine for the past 21 years. He's also certified with the American Academy of Anti-Aging Medicine. So this will be a great episode for you guys. He practices regenerative medicine with a focus on men's health, and Rougiette with HRT has achieved incredible results for men. You guys are going to want to tune into this to the end because we're going to unpack a lot of stuff today in terms of root cause and really get into a lot of fun stuff. So without further ado, welcome to the show, Carlos. I'm excited for today's interview, man.
Thank you, Jason. Great to be here. It's a great topic. We have to all address our health with this crazy world we live in.
100%.
And, it's Memorial Weekend, so I hope everybody's planning to relax a little bit and have a great long weekend. Keep it safe and fun.
Love it. Yeah, we'll talk a little bit about the relaxation because one thing that we're super, super big on is stress management. And so I want to get into a little bit of that. But let me just ask you one question first. I start out the show with all of our guests, and really, obviously, our company's Dad Bod Health. It's a funny logo. It has a little name to it, right? A little catchy name to it. But at the end of the day, it's really all about awareness. And, we've kind of shifted a little bit here because, and you could probably remember this, not that long ago, pre-pandemic, the dad bod was thought of as maybe a cute and cuddly thing. There was a lot of women out there saying, I'd prefer a guy with a dad bod. In my opinion, that's just to make yourself feel more comfortable, right? That makes you feel like you don't need to work as hard on your health as if your significant other has the dad bod. But now times have changed, and obviously the dad bod is it's not a healthy trend. It's a scary thing. And with COVID, most of these people that passed away was directly related to comorbidities and, chronic conditions, chronic disease. And we know that being overweight and being obese leads to a lot of these issues. And so my question to you is really just to get your take on not necessarily just the dad bod, but our nation as a whole, where we're at with health and, where we could potentially be headed.
Well, I think we've seen the worst of the worst, what happens when some people in our healthcare system may have not paid too much attention to preventative health, especially with obesity in the middle. We need to really go back and really look at what's important, to keep us healthy, and not look for a magic pill and not look for, one day, 24-hour results. We need to look back and look at our diet, exercise, our free time. What do we do to relax and engage in social interaction? So, who's best to do that? In my opinion, it's your primary care physician. It's people in your community. And I don't think, I think our nation as a whole really needs to pay more attention to how do we address those issues right from the beginning. I think I mentioned this before, is primary care doctors should have dietitians in their office, and maybe even exercise consultants, and and life consultants, what do you do on your free time? What do you do to, what is your diet base? How to teach somebody how to shop for healthy foods. And if you did that right from the start, I really believe the nation will be healthier, healthcare costs would be much less, and we would be heading the right direction.
I agree with you, and you hit on a lot of good points. And I think, the reality is this is, we've gotten so far away from wellness and prevention and become so fixated on treatment and treating disease, we live in a society of Band-Aids on disease, right? Like, you go into the doctor these days, if you're overweight, most physicians these days, unless it's a private thing, don't have a lot of time to spend with the patients. And so, hey, I got 5-10 minutes with you. You've got elevated blood pressure. We got your blood work back before you came in for your visit. Your cholesterol's all over the map. And here's a couple medications. You need to get more active. You need to eat less, and we'll see you in 3 months. And that's about it. And it pains me to think that with a little bit more time and a little bit more structure, because here's the thing, most people out there who are truly vested in their health, that truly care about their health, take what their physician says to heart. And, they're going to listen to what you tell them in that 5 minutes. If you had 10 or 15, maybe even a little bit more, when you can sit there and say, look, like, here's the reality is, you mentioned the grocery shopping, teaching them how to shop, maybe having the dietitian on staff there, not just saying, go get more active, but giving a little structure. Hey, let's walk 3 times a week for 30 minutes to start, something like that. Getting some, embedding those little nuggets in their head so they can take action on it versus, hey, here's your prescription, see you in 3 months. We've gotten so far away from addressing the root cause. And that's why we're so passionate as a company about what we do, because at the end of the day, until you address root cause, and that, like, the problem's not going away. A lot of times you see these people, they'll get put on a medication only to come back 3-6 months later, or maybe 2 years later. And what do you do with those medications? Ultimately, you got to start increasing the dose, because until the root cause is addressed, those medications aren't only going to work so long, because things are going to continue to compound on each other. And so I love that you brought up the Memorial Day weekend thing. So I don't want to forget about that. So let's go there for a second. You mentioned social interaction. You mentioned what you're going to do in your free time. We live in the most hectic society, this rat race society, where people are go, work until they can't work anymore. And the relaxation piece, the social interaction, especially with the pandemic, really has gotten kind of tuned out, in my opinion. And so I know that a lot of our men that we work with, one of the things that they're starting for is that communication, that brotherhood. And that's why I think they become so successful with what we do, is that they get in there and they're like, oh, there's other guys like me that want to get healthy. And now I've got guys that I can actually communicate with. I was talking to my wife today. I'm like, dude, I haven't had a guy date in a long time. And so what, in your opinion, because we're so big on stress management, in your opinion, like, what should people be doing with their free time? Like, how can we help bring a little bit of awareness to some things, some action items that these guys and even women that listen to the show, like, what can they do to decompress, to lower their health risks just by decreasing their stress? What is your take on that?
Well, let's give, like you said, Memorial Weekend as an example. Let's start, today, tomorrow. You could start off your day with a little exercise. And when I say little, it doesn't have to be doing a marathon. You can go for a brisk walk. You can do a little exercise, a little weight resistance training, but plan the weekend. Try to get outdoors, like outdoor activity. There's parks around every community. If you live in the mountains, there's hiking trails, and the beaches, there's beaches. Try to avoid crowds. You don't necessarily have to be around a lot of crowds, but go with your close friends, family to those places, and have a nice day. Social interact. Now that most people are vaccinated, we do have sort of a green pass to do more things than before. So everybody's in a unique situation. So look at your situation, and if you can, please do go out there, go with your close friends and family, have a barbecue, and talk and eat decent food. keep the liquor to a minimum, but it's okay. Have a cocktail or two or a couple of beers, and that social interaction goes a long way.
It's huge.
So the bottom line, at least for this weekend, is to get out, talk to your friends and family, smile, laugh, exercise, and then that should carry on to the next week and going forward. You know, this is a good weekend to let loose in a healthy way and have fun. That can go a long way.
I love it, man. And I love it. And I think these are things that don't get talked about often enough. I mean, it seems so minuscule, but there are so many people out there that are starving for that communication, that social interaction, those emotions that they can share with other people. I know, like, I've seen people out there talking about shaking someone's hand for the first time, giving somebody a hug for the first time in a long time. And as humans, that's what we're meant to do. And I think that, you know, we've seen the suicide rate and the mental health issues skyrocket with all this. And I think at the end of the day, you know, and you know this, like, heart disease is the number one leading cause of death in our country. It's not a pandemic. Heart disease will remain the number one leading cause of death. And that's just the facts. And so, you know, one of the biggest leading causes of heart disease is high amounts of stress. I'll tell you, as men, we see this a lot. Men come in and one of our, so we pound the table for what we call our 4 pillars of health. Not a lot of guys in our space are talking about this. Most you know, health and wellness and fitness companies love to focus on the diet and the exercise. And we believe that's only 50% of the battle, because if you don't have your sleep and your stress aligned with the healthiest version of yourself, with the guy that you want to become, wherever you're at in your journey, till you optimize your sleep and you managing your stress on a regular basis, your efforts with diet and exercise are not going to pay off like they should. And so one thing that we see a lot of is guys coming in and telling us straight up, man, I feel like I got the stress part under control. Like, that's not a big issue in my life. And every time I hear that, I'm like, man, you're lying to yourself, because as men, you know, you might not feel that stress, but I feel like we've been conditioned as men to carry around larger amounts of stress than we even realize. It's the old adage of, you know, rub some dirt on it, no big deal. You get a wound when you're a kid, just rub some dirt on it, no big deal. Or big boys don't cry. So we're conditioned at a young age that, like, keep that stuff in. You know, you don't need to share that. And I feel like as men, we need a bigger outlet, more outlets. And so one thing that we're big on is we have a full kind of morning routine that we help guys build out, where we come in and we're like, look, put a gratitude journal in your life. Do it every day. It seems so minute. Incorporate some deep breathing or meditation into your life. Start taking some social media detox. You know, don't start your day by jumping on your phone, looking at emails, looking at Facebook posts. You know, something's going to trigger you, something political, something race driven. There's something that's going to make you mad. Why are you going to start your day like that when you can control it by being intentional about your day? So there's so many little outlets that we have, but not enough guys take it seriously enough. And I'll see guys come in and they're like, it's not a big deal. They blow it off for 2 months. And then they wonder why they're not getting the results that some of the other guys are getting. And I'm like, dude, you can't outwork a bad diet and you can't outwork hormones. And if you're trying to outwork cortisol and ghrelin and leptin and all these things that are all jacked up when you're not sleeping and you're not managing your stress, you're working an uphill battle, man.
You're absolutely right, Jason. You've hit so many great points there. And me as a wellness physician and hormone replacement physician, nothing works if I have a patient with high cortisol levels or a patient that's not sleeping well. I mean, those are the master hormones, the cortisol levels, and you know, it can be checked, and you know, but never let people have to learn to relax, to get their necessary sleep, and then everything starts falling in place, including 100%. Their blood pressure and weight loss. But not until they get confronted and they realize that that's their number one issue will they not progress.
Yeah, no, I'm with you. And that's why we list the pillars the way that we do. And sleep and stress management are first and second, because until you get those aligned, your efforts aren't going to pay off like they should. And so I think there's such a need for that. I don't feel like enough guys commit to making themselves a priority. It's almost as if we hear this a lot. It's like, I feel selfish for making my health a priority because I got to give to my family and those who mean the most to me. I'm like, dude, you're only asking for a recipe for disaster. It's like, until you know that that's not a selfish thing, we live one time, and it's not selfish to make your most important asset your biggest priority. It's the old, the flight attendant analogy, right? Like, put your mask on first before you can help anybody else. And we live by that. And until guys can open their mind up a little bit and realize that. So let's shift over a little bit to your story. Let me just ask you straight up, like, what inspired you to even go into medicine? Because I'll tell you from my standpoint. So my wife is a pharmacist, and she did 8 years of school as well. Then she did a 2-year residency. So she stacked up 10 years of school to go into and to become a PharmD. And she loves it, but it's one of those things where it's like, you either know that that's what you really, really want to do. You don't sign up for that for the financial aspect. Like, that has to be your drive. That's got to be your purpose, your passion. I remember when I worked in the ICU, there were clearly, a few physicians in the ICU that I worked with that that was not their purpose. That was not their passion. And it came out every single day in the form of them being a straight up asshole. Like, I'm a night ICU nurse, and I'm calling you at 2 a.m. because your patient is crashing, and you're cussing me out on the phone for calling you and waking you up. Dude, you signed up for that. So I want to know why you signed up for that.
Yeah. So I don't come from a medical background, which there's nothing wrong with that. But my parents, sure. We immigrated from Cuba. So we came here, we started from scratch, but a very supportive parents. So, whatever I wanted to do, they would be behind me. My brother is 100%. But I think since a child, I was always interested in the sciences, the biology, animals. I went that route throughout high school. I participated in a pre-med program. So my first bypass surgery, cardiac bypass, I was fascinated by it. Yep. And I think I also was fortunate to have a lot of influences growing up with friends that their parents were physicians. And I spent a lot of time in their homes, and I kind of got you can understand the fabric of medicine and the lifestyle and what they were going through. And I learned more and more, and I pursued the medical field, and I did it through a osteopathic medicine, okay, which also does a lot more of the holistic approach to medicine, a little more of a wellness, musculoskeletal, but also encompasses everything else an MD does. So it's a very comprehensive program, and I went that route, and turned out to be an emergency medicine physician where I could see a little bit of everything. Whatever walks in the door, I got to be ready for.
Oh, I love it. No, I love it. And look, that was my history too. Like we talked a little bit about before the show is, I started my career as an ICU nurse, and probably hindsight being 2020, that probably scarred me a little bit because I started in the ICU at 23 years old. And look, man, that's too young to be seeing people die almost every day. And I just wasn't mature at that time. And I think, that was a big inspiration for me later on starting our company. But the reality is, man, is like, that's an intense atmosphere. So I want to ask you about the 2 letters after your name is D-O. Yes.
Yes.
Okay. So this was a little bit of a weird stigma back when I was in the ICU, and I'm not sure if it still exists. I haven't worked in the hospital in a really long time. So my wife makes fun of me now because she's like, you don't have a clue. Like if you walked into an ICU right now, like there's none of that stuff that your balloon pumps and Swan-Ganz catheters and all that stuff that you were dealing with. Like that stuff is so changed. You wouldn't even recognize when you walked in the room. I'm like, you're probably right, honey. You're probably right. But I don't want to go back there. But with that being said, when I was in the ICU, there was like this stigma that like, for some reason, DOs weren't as good as MDs. But I remember a couple of DOs that I worked with that I had like the utmost respect for because exactly what you said. They were looking at the whole picture and not just lab values and vital statistics and all this. Like they wanted to know everything about the patient. One of them was a renal physician that I worked with, and he was great. And I loved that guy because he would come in a much more calm manner and really address the whole thing, including the family, right? It was a great approach and I loved it. And so have you ever experienced any of that, or like what's been your experience with the whole MD DO kind of thing?
Yeah, and it's been good. It's been good, but that all also depends where you practice. I would imagine the size of your where you're at. But DOs in general are accepted across the country, every state. In fact, nowadays the whole post-training residency programs are combined with the allopathic or MDs. So
Okay.
we kind of share. The medical schools are still separate, but the postgraduate training is now under the same umbrella.
Okay.
So we still get the education of the allopathic, but we also still get the education of a DO, which is one that really looks at the whole picture, the family dynamics. If we have to keep medicines to a minimum, we will.
I love that.
As long as we achieve the same results
Yep.
in a safe manner. So they still get trained. They can be a family physician, or you could be a cardiovascular surgeon. Now, the majority of DOs do go to primary care. That's part of their origin of a DO, is to do more primary care. But the reality is you can subspecialize in any specialty as well. So overall, it's very well accepted. I'm sure there are some places where it could be, there may not be as many DOs in the community, and they're still adjusting a little bit.
Yeah, well, I'm speaking my age, man, but like this is back, like we're talking, a while back, almost 20 years ago. And so I know times have changed. Again, my wife makes fun of me all the time about it. She's like, you don't even have a clue. You're talking about epinephrine and Levophed and all this stuff. She's like, we were talking about pain medicine the other day. And I'm like, well, what about this? What about that? She's like, we don't even use those drugs anymore. You would be so lost. Like those medications are outdated and are very rarely used in any setting anymore. And I'm like, all right, well.
And then, but as well as I do, they go out of favor, they come back.
Yep.
So
I've
many
seen some of that
things
too.
in medicine,
Yep.
they try to start this new thing, and then before you know it, it's out of favor, and
go back to the old thing that worked. Yeah.
Yep.
Yeah, I love it. So let's shift gears here. So obviously the majority of people listen to our show are men. And I want to unpack this a little bit, because obviously, so you tell us a little bit about how you are involved with Rouget, because I know you have your practice, but then is this a dual thing, or where does most of your time go these days?
These days, I still work in the ER, but I'm doing very little, maybe 5 days a month, five shifts a month in the emergency room. So I have a wellness practice called Healthy Me Medical Therapies, and I've done this for quite a few years, where I mentioned earlier, I do the regenerative medicine, everything from IV vitamins, chelation. And
I left all that out of your description because I was these guys are not going to know what the hell that is, but you can expand on that if you want a little bit.
Yeah, it's a lot of preventative care and making sure people do not have hidden toxicities in their bodies, and ways to remove them, basically. And also a big part of my practice is men's health. So I do everything from hormone replacement therapies to peptide therapies, to a lot of erectile dysfunction issues, which is very common these days. And Rouget Men is where I started with the company from day one. It's a very happy to be part of their team. I'm one of the physicians that do consultations for them on their internet platform. And they have a very unique, effective product, and I've seen it work for many men. When it's appropriate,
Sure.
And again, there's so many things that can cause erectile dysfunction. So we mentioned earlier, a pill may not be the only solution, but it certainly can help, as long as you address the other issues as well.
Yes.
And my overall feedback has been very, very good with their formulas.
I love it. And so I want to kind of, because you talked about hormone replacement therapy. So I want to kind of relate these two. So we get a lot of guys that will come in and think, I've got low, or we see this on our free page. Like we have a free Facebook group where it's a pretty thriving community to be a free group. We don't allow any spam, no links. Like we got guys that'll come in there and try to drop like, hey, go buy my wife's Etsy shit. And I'm like, dude, get that out of here. Like if you do it again, you're out. We don't do that here. Go put that in another group. We try to keep it very clean. And so we built a very thriving culture over there where guys know that they can come, and I don't know if you're much of a Facebook guy, but I've been in a lot of health and fitness groups, and a lot of them are littered with garbage. Guys coming in there and trying to solicit their services and just spam. We don't have any of that. There's no links to buy anything. None of that goes on, and we police the group pretty well. But the reason I bring that up is because we do have some guys that'll come in there and say, hey, I just found out my testosterone levels in the dumps, and I just know that this is the one thing that's going to make me, start to thrive again as a man. And I'm like, dude, you got it all wrong, because you're 300 pounds. You feel like crap for a reason. It has nothing to do with your testosterone level. That's a very good thing to replace. But until we address that root cause, which is what we've been talking about a little bit prior to this, it's going to be all for naught. And so I want to know if you see a similar thing related to Rougette and the erectile dysfunction medications, because again, I think that it's got to be a multifaceted approach, right? You can't just give somebody a medication and say, all right, well, this is going to fix you, but keep living your lifestyle. It's like, hey, this will help, but you also need to do these couple things to make this help even more. So can you paint that picture a little bit for us and expand on what I said? Because I'd love to hear your take on both the testosterone and the Rougette.
Yeah, no, it's a good point. Well, first of all, the most common age that we see in our Rougette platform are probably men in the 50s to 70, 75. So that is an age where many men will experience erectile dysfunction. And again, it could be because of their underlying health issues. It could be the hormones are low. It could be anxiety. There's a lot of factors. And we are hoping that, if they have medical issues, and most of them are on meds, we do see their medications. We do see their weight. We're hoping they're being maximized, their health is being maximized on the back end of this, because like you said, Rougette can help them, and it does help quite a few of them. But if they really want to reach maximal improvement in ED and overall, health, they need to address their blood pressure, their underlying diabetes, their weight. And once they do all that and they take Rougette, or they balance their hormones, they're going to be a different person, both mentally, physically, sexually. Yeah. So if you can do all three of those things, that's where you're going to get the most of your benefit. And it is, it's health. At the end of the day, it's health. Yep. One pill does not do everything. You got to look at your whole condition and then add this to get that maximum benefit. And, getting somebody's testosterone level from total, we're doing total instead of free, but let's say, free is better, by the way, free testosterone, that's the one that's unbound. But if you get from a level of 300, which looks normal on the labs, to 700, which is high normal, that can make a world of a difference on the right individual. And then they get encouraged to do more exercise and lose weight. So it's everything kicks in together. And then of course, Rougette men, the formulas they make, which, we can get into now or later. But they are either, alone Cialis, alone Viagra, compounded, or formulas that combine both of those. And they're really effective because they're sublingual, which works more efficiently, faster. It bypasses all those elements when you get digestion in the stomach and the liver. So just by having a troche that absorbs underneath in the tongue and the mouth, you'll get results in 15, 20 minutes. Yep. And then if you have a combination, you'll have a shorter acting Viagra or sildenafil with a longer acting Cialis, which can be 24, 36 hours. So it's a very unique, and we can customize that to the patient's needs. We have all different formulas and dosages.
Yeah, I think it's great, man. And look, I think you mentioned the testosterone level, and I want to go back to that for just a second, because I think so many guys out there get fixated on testosterone replacement therapy and don't realize that the natural things they can be doing for their testosterone. You mentioned, and I haven't said it a single time, it's something that's, I would say it's a requirement when guys come and work with us and partner with us. We implement resistance training with everybody. And that's a great natural way to get that testosterone up. We help everybody optimize their sleep and manage their stress. Another way that you can start to see those levels go up. And so as well as nutrition, right? Like we are what we eat. And if you're eating crap all the time, your testosterone is going to start sinking, especially if you're at that age, right? And so I love the holistic approach here, and that just goes back to the DO after your name, because at the end of the day, man, like you address the 4 pillars, you get your testosterone replaced if need be, especially if you're in that age category. By the way, shout out to all the 75-year-olds out there that are still sexually active, because I would love to be that guy. That's an important part of life, and it's almost sometimes it's taboo to talk about, like on a public forum. I'm like, dude, like sex is kind of important. I mean, if my wife and I didn't have sex regularly, like I'd be pent up and built in, have a ton of anxiety myself. Talk about stress. That's a great way to relieve stress as well. And so I think, but looking at the big picture here, man, is replacing testosterone, addressing those 4 pillars, like I mentioned, the root cause stuff. And then if you're still having issues with ED, now you're optimized. Now it's like, okay, well, this is where the Rougette is like, that can be a go-to for guys that are actually taking their health seriously, and making an attempt to address everything and not just counting or relying on a pill to change that one aspect of their life. Another side of that is if you're overweight, and you're, especially if you're 30, 40, 50 pounds or more overweight, you're not going to be able to look down and see much. And that's just the way that it is. And if you're counting on a pill to fix that, but your confidence is down, your testosterone's really down, and you feel like crap all the time, then how is even the sexual performance, like if that's the one thing that you're concerned about, you might want to look at the bigger picture here, because the reality is sex is not a very long thing, as you well know. And once it's done, you're still going to feel like crap again.
Yeah. And it's impressive, since I started with Regen, and I see how many men in the 70s, and
that's so awesome. I love it.
And even a little low 80s too. We have some men, and it's they're in good shape.
That's
a
great.
lot of them are really taking care of themselves. They exercise quite a bit, and they need sex. They need sex. The sexual health has to be healthy, and it's very understandable that they may need a little help with erectile dysfunction.
I get that, especially at that age. If you're in great health and at that age, like the Rougette could be your magic pill, because you're already addressing everything. You know what I mean?
Yes. Yeah. And it just completes the picture, and they're usually happy. The key thing is getting the right dosage. That's not going to be too strong.
Sure.
Also you have to be careful. And so, having the ability and the options to have different dosages help, but it's impressive. And I think we're going to see more of that in our older populations. If they're starting to take care of themselves in the 50s, 60s, they're going to have a healthy sexual life in the 70s and even in the 80s, and who knows how long,
Yeah, I love it. I mean, and that's it's such a crucial part of a man's life. Like anybody that's out there listening right now is not going to say, I hate sex. It's not a good part of my life. If you hate sex, you're in the wrong relationship, right? Like you might want to find a new partner. And so that's just, it's just the facts of life. And so I'm glad that we had this discussion, because ultimately, man, like, everybody out there, everybody that's tuned into this show, nobody's tuned into our podcast with the desire to get more unhealthy, right? Like they're here to learn, and they're here to work towards a better version of themselves. And so we covered a lot of great stuff today. Let me just ask you one question, and if there was, for anybody that's out there, and since this is kind of your specialty now with Rougette, like with the erectile dysfunction, I know we really kind of mapped it out, right? With the core pillars and really addressing the root cause and everything that we talked about today. But like, is there one piece of advice other than setting up a consultation with you? For those of you guys who would like to get in contact with Rougette and Dr. Sanchez, we'll put that stuff in the show notes. Our team will get that in the show notes, so you guys can reach out. We'll get the website in there as well. What would be your best piece of advice for somebody out there who is struggling, not necessarily with just erectile dysfunction, but maybe they have a whole slew of issues? What would be your best, like, shortest little clip that you say, if you do this one thing, I think you're gonna start seeing more results and become a better version of yourself?
Well, first, consider the mind the most powerful organ in your body, both sexually, for overall health. So you got to get the outlook there, the positive outlook. Don't give up. if there is stress involved, you got to minimize that the most possible, and then everything will start following. So get the mind healthier, get the motivation there, and then, do lose weight if you have to. Do check your blood pressure, your sugars, and then, get your hormones checked. And if you need help with erectile dysfunction, go ahead, go to Rouget Men, get what you need. But again, it's a full picture, and the mind is the most important.
Can't agree with you more. No, this was great. And I love that you went to mindset, because our fifth bonus pillar that we talk about is mindset. We pound the table a lot on mindset, but the reality is at the end of the day, mindset is the thing that drives every area of life: business, relationships, health. Doesn't matter what we're talking about. Mindset is king. And we know that. And so I love that you went there, because until this is fixed, until you know your true why. Like I had a client call the other day, and I'm like, this guy's struggling. I'm like, dude, you've got to realize that none of this is going to get fixed until we fix the fragile 6 inches between your ears. And you've got to decide, like, why you want to do this. What's most important? You've got tons of motivators, kids, family, all this stuff, career. But why? What's most important to you? What's that one thing that's going to flip that switch and just make you unstoppable? And that's the thing. Like, that's the magic piece to anybody taking massive imperfect action and becoming a healthier version of themselves.
And don't be afraid to seek help. Whether it's a yoga instructor, a meditative person, a psychiatrist, or
tons of options,
or just listen to podcasts like this. There's a lot of ways you can learn and get motivated.
Yep. No, I love it, man. Well, this was a great interview. I appreciate you taking some time today. Go enjoy your Memorial Day weekend, man, and maybe we'll have to do it again in the future.
Thank you, Jason. Pleasure being here. Have a great weekend.
Hey, you do the same, man. Take care.